I'm Dr. Stephen Claypool, and this is an evidence-based nutrition video on fruits and vegetables. Let's start with the old adage, does an apple a day keep the doctor away?
This study answered that question. People that ate an apple a day were compared to non-apple eaters. You can see a slight trend toward fewer physician visits for the apple eaters, but after controlling for socioeconomic factors, the difference isn't significant. So, does an apple a day keep the doctor away? No, not really. You should take my quiz on the impact of dietary changes on health before proceeding with this video. If you haven't taken the quiz, then pause this video, go to my website listed below, then take the quiz, and then resume this video. The answers to the quiz come from this study, which estimated the burden of disease caused by environmental factors, including nutritional factors. This study did not actually assess the impact of making dietary changes on health. Instead, it estimates the disease caused by non-compliance with nutritional goals, so I'm making an assumption that compliance with nutritional goals would prevent disease. If you've watched my video on nuts, you won't be surprised that eating more nuts is the number 3 most impactful dietary change. Wait, you say, number 3? I thought nuts were number 1. Nuts are number 1 for prevention of heart disease, but when all other causes of death are also figured into the equation, they drop to number 3 overall. Based on this video's title, you're probably not surprised that vegetables are on the list. They're here at number 5, and fruits are number 1.
Say what?
Yes, fruits are number 1. They're higher on the list than vegetables, which are number 5.
But fruits are like desserts. They're delicious, and vegetables aren't. That's not fair.
Life isn't fair for vegetables. Even though fruit tastes sweet, making a concerted effort to increase fruit consumption may have a bigger health impact than making an effort to increase vegetable consumption instead. One of the reasons is because Americans eat very few fruits. We eat very few vegetables too, but we eat about half as many fruits as vegetables, so there's more room for improvement. And it's the same in Europe. But it's more than just amount of produce consumed. But before we dig into the differences between fruits and vegetables, let's look at the data for both.
Solid studies on fruits and vegetables have been lacking for years, lagging behind the study of other foods. But in the last 5 to 10 years, multiple prospective cohort trials have been performed. These studies have tended to lump fruits and vegetables together. Let's look at them.
Here are 4 trials from the US, Spain, and Japan that tracked tens of thousands of people. The highest fruit and vegetable consumers had reductions in mortality of 22, 37, 23, and 26% respectively. This is all-cause mortality, not just death from a focused cause. In the other videos, red meat had a strong impact on colon cancer and a small impact on heart disease. Nuts have a strong impact on heart disease reduction. When all causes of death are calculated, their impact is not as great, whereas it's very large for fruits and vegetables. More recent and detailed studies confirm the very large all-cause mortality benefit. This large study of 500,000 Europeans was detailed enough to allow us to realize that fruit and vegetable eaters had a large reduction in death from many diseases, including heart disease, lung diseases, digestive system diseases, and cancers. Fruits showed more benefits than vegetables. For vegetables, raw veggies slightly outperformed cooked vegetables. This English study was detailed enough to show that frozen and canned fruits were not protective, only fresh fruits. And this analysis of 3 studies confirms that canned fruits were not protective, unlike fresh fruits. This is presumably because canned fruits are cooked and stored in sugar and syrup. These very recent cohort trials from Europe and Eastern Europe also confirm very strong reductions in all-cause mortality. But they're especially interesting because they're detailed enough to show an even stronger benefit for some high-risk groups, specifically alcoholics, smokers, and overweight people, and smokers and hypertensives. This is relevant because some people have previously speculated that high fruit and vegetable consumption is more likely in people that are overall more healthy, that health-conscious people may eat more fruits and veggies, and it might not actually be the produce that helps them live longer, but instead it may be other factors in their lifestyle. But these studies help to discount that idea because they show that unhealthy people benefit even more.
These types of prospective cohort trials have become very detailed. Many track more than 200 food items, along with other risk factors.
And the studies are controlled for their risk factors. Remember from my other videos that this means that in addition to foods, they keep track of risk factors like exercise, weight, alcohol, smoking, nutritional supplements, marital status, education, and existing medical problems. They compare people with similar risks. So it's less likely that fruit and vegetable consumption is just coexistent with other healthy lifestyles. These more recent detailed studies allow us to take a closer look at certain disease and to take a closer look at fruits versus vegetables. Note that sugars in fruits aren't a concern, even for diabetics, because fruit still reduced all-cause mortality in patients with diabetes, and all fresh fruits are protective. We now finally have enough high-quality studies for a good meta-analysis. A meta-analysis is a study type where studies are grouped together into a large pool, which is analyzed. This provides a larger database. Published in 2014, this meta-analysis combined 16 of the cohort trials we quickly reviewed, covering almost 1 million people, of which 50,000 died. These people were followed for up to 26 years in some of the studies. From these studies, we know that vegetables are associated with a reduction in death of about 5% per serving eaten per day, and fruits are associated with a reduction of 6% per serving per day. The benefit persists for up to 5 servings per day, up to about a 25% reduction in death. After that, there appears to be no additional benefit. 5 fruits and vegetables daily is a lot, though. Few people eat that much produce. Remember that this impact is on all-cause mortality. This is a list of the most common causes of death, even ones that cannot be impacted by nutrition. When this list is pooled together into one group, the reduction in all the deaths can be reduced significantly by fruit and vegetable consumption. Heart disease is reduced the most, but stroke is also impacted, and there's probably a less significant but still important reduction in cancer deaths. The World Cancer Research Fund and the American Institute for Cancer Research published a very detailed analysis of the cancer impact in this paper. Fruits and vegetables also have a strong benefit on high blood pressure, and fruits and vegetables are inversely associated with Alzheimer's disease.
With red meat, we understand the carcinogens that cause colon cancer. Nuts improve cholesterol, improve blood sugar, and control obesity, so we understand why they reduce heart disease. But with fruits and vegetables, we don't really understand why they're healthful.
Some think the micronutrients like vitamins, carotenoids, selenium, etc. are beneficial. There's a lot of fiber of various types in produce too. I think the phytochemicals are likely to be the most important beneficial components. There are more than 100,000 phytochemicals. We already know many of them have antioxidant properties. But by and large, we don't know that much about these phytochemicals, and phytochemical composition may be an important difference between fruits and vegetables. For vegetables, does it matter if they're cooked? Well, we know that cooking vegetables denatures some of the nutrients, so raw vegetables have more nutrients. On the other hand, it's easier for the body to absorb nutrients from some cooked vegetables, so in some cases we actually get more out of cooked vegetables. In the studies, raw vegetables are slightly more protective from a health perspective, but the clinical significance is modest, so don't worry about it. Both cooked and raw vegetables are good for you. Are all the vegetables the same? For the most part, yes. Avocados have cholesterol, some have starches, others don't, but who cares? We don't have enough details yet to nitpick. Almost all seem to be protective, but there are a few important exceptions. Don't consider extremely starchy foods to be vegetables. Corn is a grain, not a vegetable. Potatoes have a very high starch level and should not be considered to be the same as other vegetables. I will cover these separately in a future video. How about fruits? Yes, for the most part, all fresh fruits are healthy. They all seem to offer protective benefits. Exceptions include canned fruit and frozen fruit, which are often preserved with added sugar. And fruit juice, these are not healthy.
But fruits are sweet. What about the sugar in fruits? Is it a problem?
Actually, almost all fruits have a very low glycemic index, which means that the sugars in fruits do not significantly or rapidly raise blood sugar levels. The sugars in fruits are released slowly. In fact, almost all commonly consumed fruits raise blood sugar much, much less than potatoes or corn or bread or many other foods. They're similar to many other vegetables, so don't worry about the sugars in fresh fruit. It just helps them taste good. And I'll cover this topic more in an upcoming video. Where do fruits fit on our scale of foods? Well, if I place fruits strictly on the reduction in relative risk of death, then they'd go slightly above nuts. But I have a problem with that because this dramatic benefit is only seen with consumption of 5 servings daily. We know Westerners have trouble consuming this much. This is probably out of reach for most of us, so in reality, the benefit is not this large. Nuts, on the other hand, have a big bang benefit with modest consumption. In good conscience, I cannot put fruits above nuts, so I'm putting them here. And vegetables are just slightly lower. Fruits and vegetables reduce all-cause mortality. Maximum benefit is seen with the consumption of 5 servings per day. I recommend increasing fruit consumption in particular because Americans tend to eat very little fruit. Oh, what about the mystery spots on this list? Reducing processed red meat consumption is number 7, not as high as you might think, in part because most of the world doesn't eat that much red meat. If this was only a study in the US, then it would be higher. What about spots number 2 and number 4? Stay tuned for upcoming videos.